The number one reason why you should choose a PPO over an HMO when it comes to Medicare Advantage. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. My goal is really simple. It is to help you make a wise and confident decision about all of your Medicare choices. If I can help you, please contact me. We review your benefits and I can help you enroll into a plan. If today is your birthday, then happy birthday to you. Phyllis Diller once said, "I'm at an age where my back goes out more than I do." I hope that's not the case for you. If it is, please get some help for your back so you can get outside. First, let's go through the 5 Medicare Advantage plan types. There are HMOs, health management or health maintenance organization. With these plans, you have a very strict network. You can only use network providers unless it's emergency or urgent care services. Some HMOs are also point of service where you can go see some providers out of network, but you are going to pay more. Those are rare, but they do exist. Next, we have the PPO, Preferred Provider Organization. In this case, you have a network of doctors that are in, and then you have doctors that are out of network. If you go out of network, you're typically going to pay more, but you have the ability to go out of network. Then we have a private fee for service. Not too many of these still around. They were much more popular in the early days of Medicare Advantage. The nuance with the private fee for service is the provider, unless they're in a network plan, the provider can choose to treat you on a case-by-case basis. That depends on whether they want to accept the terms and conditions of payment from the insurance company. If today they do, great. If tomorrow they don't, then you can't go see them and use your insurance. Next, we have a medical savings account, not to be confused with a health savings account. This is only for people that are on Medicare. And the way these work is there's no prescription coverage, there's no network, typically have a high deductible, and it deposits money into an account that you can use for your co-payments and things like that. And then lastly, we have what are called special needs plans. So if you are both on Medicare and Medicaid, you would be a dual special needs. If you had a chronic condition like diabetes, congestive heart failure, COPD, kidney failure, things like that, then you could be on a CSNP, a chronic special needs plan. The number one reason why you want to consider or choose a PPO over an HMO is the ability to go see out-of-network providers. As I've mentioned, if you're in an HMO, you're locked into that network. If you have a PPO, you at least have the flexibility to see out-of-network providers that you may need access to. You will likely pay a higher fee, but you will have the ability to do that. A couple cases would be if you need to go see a specialist that's not in the network, and that's a specialist that you want to see. A lot of mental health providers are not in network with Medicare Advantage plans, but they will accept the PPO. It'll be out of network. You'll pay more, but at least you'll be able to go see them. The other big one would be specialty hospitals like a Johns Hopkins or Mayo Clinic. Let's look at what they say. Johns Hopkins website states, "Please be advised that Johns Hopkins Medicine Hospitals and most Johns Hopkins University physicians participate with Medicare. But we are not contracted with most Medicare Advantage plans. If your Johns Hopkins Medicine Hospital doesn't participate with a Medicare Advantage plan, you can use out-of-network benefits if your plan has them." So if you got an HMO, more than likely forget Johns Hopkins. Mayo Clinic website states, "Mayo Clinic does not participate with all health maintenance organizations. In addition, an HMO will not typically pay for Mayo Clinic services without prior authorization from your insurance company. Your physician's referral alone does not necessarily constitute an authorization from your HMO." So let me give you some advice on choosing an HMO or a PPO. First, ideally, go with an insurance company that has a large local and nationwide network of providers, has good drug coverage, it has the lowest maximum out-of-pocket that you can find. Consider your overall health and finances, not just now, but in the future as well. Don't focus on all the extra benefits and goodies that Medicare Advantage plans may offer. Do not listen to the TV ads and never call them or talk to some large telesales organization. You will likely be sorry. Instead, contact me. My advice is free to you. There's no cost in calling me at all. If you use me to enroll in a plan or plans, the insurance companies pay me a commission. You cannot get it any cheaper by going direct to the insurance company. If you have questions, if you need help, please reach out to me. You can go to my website. There's a lot of information in regards to Medicare and other types of insurance on there as well. There are some contact pages that you can fill out and send over to me, and I will reach out to you once I have that States I'm currently licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee. And here's where you can help me out. If you could please just put in the comment section the abbreviation or the full name of the state that you are watching from. That gives me an idea where people are viewing and maybe where I want to get licensed at. If you live within an hour or so of the Charlottesville, Virginia area and you would like to meet in person, please reach out to me and we can probably arrange to do that at a safe and convenient location. That's it for today. So the number one reason why you would consider a PPO over an HMO is the ability to see out-of-network providers. I'm Chris Prang, the Medicare analyst. Make it a great day.